Hello, today's video is about examination of the patient, and this is the continuation of the video from history taking. Now, examination is categorized into three parts. There is a general examination, local examination, and finally systemic examination. Starting with the general examination, general appearance of the patient from head to toe, and this starts from when the patient is entering the room. If the patient is ambulatory, you can do that. If it is non-ambulatory, you can also continue from head to toe. And the principle is A, B, C, D, E. This is just a mnemonic to help you memorize. A stands for appearance of the patient. Is the patient healthy or ill looking? B is the body of the patient. Is it wasted or is it obese? Or edematous, and etc. C is for color. Is the patient paler, like whitish, or is the patient bluish? Is the patient cyanosed or yellowish, which indicates the patient is jaundiced? D is decubitus, meaning the position of the patient. Is the patient in supine position or elevated position, like in cardiac position, 45 degrees? The patient is elevated 45 degrees. And finally, E is for environment, the surroundings of the patient, the things which are connected to the patient. Is the patient connected to cannulas or catheters, or is the patient have a face mask? You need to record. And finally, on the general examination is vitals, temperature, pulse rate, blood pressure, and respiratory rate. You need to record them. They are very important. Now, moving to systemic examination, you need to start with the affected system first. And the basic systems I have highlighted it here. There's nervous system, cardiovascular, respiratory, GIT, and the genitourinary system. They are very important in your history taking and physical examination report. And the principle here for systemic examination is IPA, which is inspection, palpation, percussion, and finally auscultation. Now I have described it just superficially. It is a summary of how to examine the parts which are important in examination of systems. I'm going to make another video which is going to talk about these systems in details. So let's start with cardiovascular system. The principle is here is inverted J, starting from the hand, wrist, arm, neck, and finally to the chest. They make a J later. So when we invert it, it becomes the inverted J. That is how cardiovascular system examination is done. You start by inspection, you look for Osler's node, splinter hemorrhages on the fingers and the palm, finger clubbing, which usually these indicate to maybe respiratory problem or cardiovascular problem. Pulmonary edema, pulse also you need to record, and you need to observe if there is any traditional or surgical scars on the chest. And finally, you need to look for chest deformities. On palpation, you need to palpate for the apex beat, thrills, and the hips. And you need to auscultate the heart sounds, S1 and S2, S3, and murmurs. Moving to respiratory system, on inspection, you need to inspect for chest expansion. Is it symmetrical? And also you need to measure the length. Normal is usually the chest expansion normally is less than 5 centimeter. And finally, you need to look for chest indrawing. These are the signs of respiratory distress for problems involving the respiratory system, such as maybe something like pneumonia. Moving to palpation, you need to palpate for the trachea position. Is it centrally located or is it deviated? Usually, if the trachea is deviated, it means that there is a problem in the mediastinum. There is a mediastinal shift or of any problem involving the chest cavity, compressing the lungs, or there is maybe one of the lung maybe has collapsed. It reveals itself during the examination of the respiratory system. On the part of palpation, the trachea will be deviated. Other thing which you need to palpate, you need to palpate for muscles, the tenderness on the chest, and tactile vocal parameters. On percussion, you need to percuss the chest and determine the note. Is it resonant or is it dull? Normal is resonant. Dullness means there is an abnormality. And finally, on auscultation, you need to auscultate or to listen for breath sounds and abnormal breath sounds, of course. Moving to a GIT system, uh, by inspection, you need to inspect for angular stomatitis inflammation. So also you need to inspect for mouth ulcers and parotid swelling. Moving to per abdomen, you need to inspect any distension of the abdomen, if there is any scars, traditional or surgical scars, and also need to look for distended veins. From your anatomy, caput medusa, portal hypertension, indication of portal hypertension if there's a distended veins on the abdomen. On palpation, you need to do both superficial and deep palpation, looking for tenderness, muscle guarding, rebound tenderness, and also the muscles which we are talking about here is the liver, the kidneys, and spleen. Don't forget to measure the liver span, which is always from 8 to 12 centimeters. For percussion, you need to do it only if the abdomen is distended. You need to do percussion and in the fluid thrill examination. In the last three, you need to auscultate for bowel sounds and bruits. Bruits that might indicate maybe there is a aortic aneurysm, the abdominal aorta, or the renal bruits and iliac bruits. And lastly, moving to the nervous system. Here, when you examine the nervous system, it means that you are also examining the locomotor system, because you cannot assess the coordinators such as the brain without assessing the effectors, which are the muscles. So in nervous system, we start with higher centers, starting with the level of consciousness. Is the patient conscious or the patient is unconscious? The patient is alert or not alert? Things like that. And from there, you move to orientation. Is the patient oriented to the surrounding? Is the patient oriented to person, place, and time? And without forgetting memory, the long-term memory and the short-term memory. And lastly is Glasgow Coma Scale. Normal is 15. 15. That is 15 over 15. Glasgow Coma Scale. You need to assess. And second part is cranial nerves. You need to assess the cranial nerve from the first cranial nerve to the 12th cranial nerve. And lastly is the motor system. You can use the principle or a mnemonic, which is TPC, reserved sugar. T stands for tone, P is for power, C is for coordination, R is for reflexes, and lastly S is for sensation. From your examination, you need to collect your findings from your history and your examination and formulate a provisional diagnosis. What you are thinking might be uh, wrong with the patient. What kind of disease is it? That is a provisional diagnosis. Then from there, you need to formulate a differential diagnosis, other diseases which present like your case. And lastly, after doing your investigations, you are going to confirm or you're going to formulate a final diagnosis. From there, you need to formulate a management plan, starting by listing all of the investigation of each problem, list the treatment plan for each problem, the prognosis, and the prevention plan. These are the kind of investigation which you can do, starting from the bedside, laboratory, radiological investigations, specialized investigations.